Hello, my Vietnamese friends, colleagues. I'm here to announce our future programs and future projects in Vietnam. Okay, not I say Vietnam because it's my headquarters. Let's my base point. Okay, from here I teach for many countries. I usually have students from China, from Philippines, from Thailand, and so on. So if you are also from surrounding countries, this is a good information for you too. Okay, so what we are doing starting this year in Vietnam? What is our new project? If you are a really beginner, I am starting. I just graduated. I am fresh from the university. I just graduated, and I want to start orthodontics. I would like to learn how to do orthodontics to my patients, and I want to implement this to my clinic. So what is the ideal course for you? What we have designed for the beginners, but have in mind this is also work for long-term doctors that never had contact to this philosophy, okay, this idea. So what did we program to you? Is a real basic course in bioprogressive. What is this? What is bioprogressive? It's a way of thinking of cases since any age, okay? So you can take kid, you can take adult cases, and you have a solution for all malocclusions in a different manner, only treating with wire and brackets. So this is the idea of bioprogressive. This is a concept developed by Professor Ricketts in the United States. And I had the opportunity to learn from these people. And I bring this to Vietnam a long time ago. And still working marvelous for many cases. So this is a big starting, a very good starting for your practice. So you will learn how to diagnose, how to make a good treatment plan, how to make a very nice cephalometric analysis, how to make a very good planning for your case, and understand how to place well the brackets, what kind of brackets do we need, what kind of wires do we need, how can I treat, and how can I use for different kind of malocclusions, class 2s, class 1s, class 3s. Should I extract? Should not extract? What should I do to avoid extractions? Why should we avoid extractions? Certain cases, if you want to extract, I do not recommend, never extractions, okay? But if you want, I can give you some hints, okay, to at least finish okay your cases, okay? So I have solutions for the class 2s, for the class 3s, and certain mandible deviations using only bioprogressive. So this course is designed for a real beginner, or if your office, you never practice bioprogressive, you want to learn, this is also a course for you. So starting now, a basic course, bioprogressive, this is for beginners or for someone that never practiced, is starting now. Probably in May, we will start a new program in Saigon, in the south, but the dates will be confirmed, okay? So if you follow here us, click here and submit a comment or do click here in our forms to give your number, to give your contact, okay, your email, whatever you want us to contact you. No matter if you are in Vietnam, north, south, or whatever, in another country, we will contact you to give you more information and how can you subscribe to the courses, participate to the program, and be together with us into this very nice, okay, condensed as most as possible course for bioprogressive. Good course for the beginners to start in a very good way, and very good course for those who never learn how to avoid extractions, how to treat certain hard cases with the bioprogressive. We have a great tool, so join us and be our student. The course is designed 5 modules of 4 days each. Okay, so this we did like this to not exhaust you guys. Okay, in the past we usually did 5 days, but 5 days I recognize that the last day people are too tired, so we decided to reduce a little bit and condense, and sometimes certain online classes, just theoretical, we can do as well. So in the middle of, in between modules, we can target some subject that we are missing or you need clarification. We can do online as well, like remediation. So this way, we can combine a very condensed but very active, very good, speed. I mean, to make everything absolutely straight to the point, not give rounds, and you guys can learn everything to be really good to your practice. You can come to your practice and immediately apply something to treat your patients. Okay, so this is the real reason for this course. Make your practice more profitable, and you can treat more cases and more patients immediately in your office. So again, if you have any questions, come to us. Now following, we designed another courses as well, not only the bioprogressive. Okay, so we have kind of sequence of courses. So bioprogressive is the beginning, the main target for the beginners or someone that still want to learn this. Okay, but we also have something more advanced. Okay, more advanced means if you have already the basic knowledge on cephalometrics, and you have some already understanding the VTO, the idea of repositioning, rotate the mandible, and so on, these things. When should I do this? When should I do that? Now we have something else for you, okay? The next future course is a little bit more advanced, using multi-loops mechanics, like the meow or the Giao or something similar like this. So we have courses on multi-loops, so you can treat with different tools, similar mechanics, but the objective is a little bit different, okay? Of course, at the end, we want the best for the patient. That's okay. But the way we treat sometimes using the multi-loop can be faster, can be easier than if I apply bioprogressive. But sometimes I need to come back to the bioprogressive and mix both. Okay, sometimes I do the meow, sometimes I do the multi-loop, but in the middle or at the beginning or at the end, I need to work with some bioprogressive to close this case very nice. So this way you have tools for any stages, okay? So I need to keep going. Not only bioprogressive is enough. We can do also something else like the multi-loop. So those courses we will call advanced. Also in modules of 4 days. So you will learn also some different mechanics and also different diagnostic tools. So for those cases, we will also apply Typodont, wax Typodonts for this. So you will learn from the bioprogressive using the wax Typodont, targeting a little bit more on class 2 cases. But with the multi-loop, we will give you solutions for certain class 2s, which is better to be treated with the multi-loop, certain class 3s, in certain cases with mandible deviation, we will also apply in advanced courses. Okay, so this is the structure of our courses, starting like basic as bioprogressive, advanced in the meow, multi-loops, and so on. Later on, if you want to keep going deeper and deeper, if you are a prosthodontist, if you are implantodontist, if you are orthodontist and want to give solutions for TMD cases, TMJ problem cases, go deeper and deeper, we will also start another VSC-based curriculum, at this moment still in Hanoi, okay, because this is our headquarters at the moment. So the VSC basic curriculum is for you going deep in very advanced diagnosis, very, very high quality treatment, okay? Understand cases to treat from the joints, okay? Reposition the mandible in the space. So the basic curriculum is this for you, because after the basic curriculum, we will also start advanced courses for prosto and for ortho. So the orthodontists will have advanced courses, prostodontists will have also advanced courses. In between, we have the splint courses. This is for both, okay? For the ortho and for the prosto. Sometimes we need to treat cases mixing both. Sometimes you can, if you are a prosto, you want to listen from the ortho side, you can join. If you are orthodontist, listen from the prosto side, you can join. So at the end, this is very advanced. This is for you, okay? So if you already took courses with me in the past and you want to keep going in higher level, the VSC basic curriculum is for you. In the second semester, in November, we already programmed for Hanoi as well, for Vietnam, and also only for Vietnam, for all surrounding countries, a big congress on VSC concept. Names like Professor Sadao Sato will be present, I will be there, Professor Daniel Toni will be there, Ken Tajima will be there, Professor Agnieszka Chizenda from Poland, we have Anastasia from Russia, we have a lot of people coming to make this a very, big sound, noise in Asia area. So please keep in contact with us to know deeper. When everything is ready, we will launch and you can already subscribe, because certainly you're going to fulfill the house, and we have certain limitations because this is inside a ballroom in a hotel, and the limitation may be 200 people or maximum 250. So this is the very good congress, the first time doing in Asia, okay? So join us for the VSFeed Congress as well. So many programs, many things new for Asia area and for surrounding countries of Vietnam. Okay? If you have any question, if you have anything to clarify, message us. You have a contact here. Just click the link, put your name if you are interested. The team, organizer team, will be in contact with you. If you have any question, you can come directly to me, okay? So, good news, very good news for the year in Asia, especially Vietnam.